Let's do a quick introduction on sepsis, why and how it happens.
To put it short, sepsis is a life-threatening condition. It's where your body reacts to an infection, your immune system gets triggered, and then your immune system gets out of control basically, and it starts damaging its own tissues and organs, causing organ failure. People think it's a contagious disease, but it's not. It's completely non-contagious. Sepsis is becoming more common in society because of things like aging population, antibiotic resistance, weakened immune systems, and multimorbidity. People think sepsis is the same as septicemia, but where septicemia is different is it's a microbiological invasion of the blood instead, which can lead to sepsis, but it's not the same thing as sepsis. Septicemia leads to sepsis. Sepsis is mainly caused by bacterial infections, but it also can be fungal and viral. The main thing with sepsis to prevent the worst symptoms and death is finding the early recognition signs, so early recognition is key. There are 7 simplified steps of sepsis. It's not what you're going to find in the textbooks, but it's going to give you a bit of an idea of what's going on. So firstly, your immune system is triggered by a foreign pathogen, causing the immune system to fight the infection through your white blood cells. Without going into too much detail, you have inflammatory mediators and cytokines released into the blood, and these can cause symptoms such as vasodilation, leaking capillaries and blood clots, which as a cause means you get low oxygen perfusion to the main organs. This causes metabolic acidosis, and it can cause septic shock, which is the most severe stage of sepsis, which will lead to multi-organ failure and some cases death. 3 stages of sepsis: sepsis, severe sepsis and septic shock. So the first stage of sepsis and your infections are picked up on your observations, your respirates, high heart rate, temperature, all those type of things that you pick up on. Is there an increase in confusion? Are the white blood cell results abnormal? Are the inflammatory markers and the biomarkers normal? These continued symptoms of a suspected infection will lead into severe sepsis. Some of these symptoms include decreased urine output. Is there any discoloured patches of skin on the body, a widespread rash? Altered GCS, are they breathing normally? You're getting a high lactate reading on the blood results. Altered consciousness, all these type of things can lead into septic shock. Septic shock is where you usually get multi-organ failure. You'll get similar symptoms as severe sepsis, but they're more prominent and severe. It's where you get your widespread vasodilation causing hypertension, high lactate, hyperperfusion to the muscles, the body, and this is the part with the highest mortality rate. About 30 to 40% of patients in this area will die. So this is your sepsis 6. If you're suspecting sepsis, think buffalo. Are we doing blood cultures on the patient to identify the type of bacteria? Are we doing a urine output, a fluid balance chart, fluids into the patient? Are we maintaining the blood pressure to avoid shock? Are we giving antibiotics to treat the infection at source? Are we looking at the lactate to look for hyperperfusion and cellular dysfunction? And does the patient require oxygen to maintain aerobic metabolism? So whenever you see query sepsis, think buffalo. So that is just a quick rundown on sepsis. I hope it helps. There's so much to learn about sepsis. We'll go into more detail at another time, but that's just an introduction to it.